welcome to the second part of our presentation on the injectable anesthetic agents. So again, this presentation will talk about the dissociative anesthetics. So as a recap, there are 5 injectable anesthetics that are currently more employed in anesthesia in dogs and cats. Now these are propofol, afaxolone, etomidate, ketamine, and tiletamine. So propofol for ketamine and tiletamine, these are considered to be dissociative agents because they will induce a cataleptic state. So when we say cataleptic state, um, this is a condition wherein that is characterized by seizure with the loss of sensation and consciousness accompanied by the rigidity of the body. So in this presentation, we're going to discuss more about the properties of these dissociative anesthetic agents. So what are dissociative anesthetics? When we say dissociative anesthetics, these are agents that induce a state of altered CNS activity in which the anesthetized patient feels totally dissociated from its surroundings during induction. These agents produce marked sensory loss. There is analgesia, amnesia, and paralysis of movements without apparent loss of consciousness. So the patient appears to be awake, but actually is unconscious. The term dissociative anesthetics is derived primarily from the use of ketamine in man and appears to have some or the same meaning with that of animals. Anesthetics include phencyclidine, ketamine, and tiletamine. Starting with ketamine. So ketamine is considered to be the most used dissociative agent in veterinary clinics. It is actually a derivative of phencyclidine. It is classified as a controlled substance, meaning that it has a potential for abuse. Specifically, it is a Schedule 3 drug. It is used most often in cats than in any other species. And for cats, it is used specifically for minor procedures or to facilitate restraint. It can also be combined with other drugs. So we can combine that with tranquilizers as a pre-med. And of course, we also have the opioids to induce general anesthesia. In sub-anesthetic dose, it can be administered via continuous rate infusion for its analgesic property. Tiletamine hydrochloride. So tiletamine is a dissociative anesthetic. It is combined with the benzodiazepine sulacipam in a 1:1 ratio. And it is available as the brand name Telazol. Again, it can be combined with, it is administered IM or IV to produce sedation and anesthesia. So again, the tiletamine is the dissociative anesthetic, and when we are going to combine that with benzodiazepine, so we are actually combining the muscle relaxant property of the benzodiazepine. So there is dissociative anesthesia plus muscle relaxation. It can be used alone or in combination with other drugs, and this is a controlled substance, just like the ketamine. The dissociative anesthetics, one of the properties of that is that it will decrease wind-up pain. And when we say again wind-up pain, that is the pain signal that comes into the CNS becoming more stronger and longer lasting through constant stimulation, particularly in the spinal cord. So this is a physiologic process that involves activation of the receptors that are normally dormant on the nerve endings. So this happens, for example, when you will not provide an analgesia to your animal during the procedure, so that when the animal will wake up, it will feel more pain. So of course, the dissociative anesthetics also provide analgesia, and that is through the simulation of the anesthetic with the mu receptor. The dissociative anesthetics also produces a trance-like state to the animal. So when we say trance-like state, the animal appears awake, no, it is immobile, but it is unaware of its surroundings. Is the trance-like state that is produced by dissociative anesthetics. So there is muscle rigidity as one of the signs of the trance-like state. The animal appears awake and it is immobile. So ketamine and all other dissociative anesthetics are NMDA receptor antagonists. So basically what they will do is that they will bind within the channel of the NMDA receptor and will act as a non-competitive antagonist of the NMDA receptor. So normally what the channel will do is that it will provide a channel for the influx of the cations, calcium and sodium ions towards the cell, towards the inside of the cell. So of course, when that happens, the cell would reach, a would be more positive and it will be activated, to reach the action potential. But when in the case of ketamine, when it will bind to the NMDA receptor, it blocks the receptor, inhibiting the influx of the cations. So inhibition of the NMDA receptor by ketamine will prevent the influx of calcium ions and or sodium ions, preventing the neuronal membrane depolarization. This decreases the probability of neuronal firing, preventing further propagation of neuronal signal. So the neurotransmitter release or downstream signaling mechanisms are also inhibited. So this is now the classical MOA of our NMDA receptor antagonist and a dissociative anesthetic, ketamine, as well as the tiletamine and the phencyclidine. The action of ketamine is reached at about 1 to 2 minutes after IV injection. After IM injection, that is about 10 minutes. For the duration of the effect, it is about 20 to 30 minutes. And increased dose will prolong duration but doesn't increase the anesthetic effect, meaning that the anesthetic effect is not dose dependent, it is dose dependent only for the duration of the effect of the anesthesia. All dissociatives are either metabolized in the liver or excreted and changed in the urine. So this should be avoided in animals with liver or kidney disease, and blood works are required for older cats. Otherwise, the dose might be changed or the drug itself can be modified. According to the Federation of Veterinarians of Europe website, ketamine is very widely used for anesthesia and analgesia by the veterinary profession in Europe. It is the only injectable anesthetic that is safe and well tested in the full range of species under veterinarian's care. It is used for GA, general anesthesia, as a primary anesthetic and for the introduction to inhalant anesthesia. It is an essential anesthetic for large and small domestic animals, common exotic pets, horses, laboratory animals, including primates, wildlife, and zoo animals. These are the dissociative effects of these agents, the dissociative anesthetics, on the central nervous system. First is that it produces a cataleptoid state. So when we say cataleptoid state or catalepsy, that is a condition characterized by trance or seizure with the loss of sensation in consciousness and accompanied by the rigidity of the body. So there is rigidity of the muscle. The reflexes are intact, particularly these reflexes, palpebral, corneal, pedal, and other reflexes. For the ocular effects, of course, the eyes remain open during the dissociative anesthesia. The central pupil is dilated, and you can use since the pupillary light reflex is still intact, so the animal may not blink during the procedure, causing the dryness of the cornea. So in this case, you can use ophthalmic ointment to provide moisture to the cornea. In case of ketamine, in cats, it can produce muscle rigidity. And when ketamine is used, it is important to add a muscle relaxant to the anesthetic protocol, as dissociative anesthetics may induce muscle rigidity. When we are going to compare that with tiletamine, so of course, tiletamine is combined with sulacipam, which is a tranquilizer, so it is not a problem in the case of tiletamine. It also provides analgesia, both somatic and visceral analgesia. So the analgesic action at the sub-anesthetic dose is believed to be primarily due to the NMDA receptor antagonism in the brain and the spinal cord. as well as its action on the mu receptor. In man, it produces amnesia, so it is assumed that it is also does in animals. So another property of the dissociative anesthetics is that it increases the sensitivity to sensory stimuli. So the animal might react when they hear something. And again, it increases the sensitivity to stimuli such as noise. For the cardiovascular system, so dissociative anesthetics are quite different or quite different from other anesthetic agents because it has an opposite effect to the cardiovascular system. It increases the heart rate, it increases the cardiac output, and it increases the mean blood pressure. This is all due to the stimulation of the sympathetic nervous system or the fight or flight response. So the increase in the heart rate and the myocardial oxygen consumption may be of concern with patients with pre-existing heart disease. So for the respiratory system, dissociative anesthetics it may cause a change in the respiratory rate and the tidal volume. So again, when we say tidal volume, that is the amount of air that moves in or out of the lungs with each respiratory cycle. In terms of the respiratory depression, so it is not as depressive as the other anesthetic agents. It can also cause apneustic respiration at higher doses. So when we say apneustic, if given at a higher dose, it may cause now the animal to stop breathing. So apneustic breathing is abnormal in the breathing pattern. These are the adverse effects of dissociative anesthetics on the CNS. So it can increase the response to sensory stimulation. It should be avoided in animals with seizure, those animals that have ingested CNS stimulants, and also those animals that undergo neurological system procedures. Um, it is a psychedelic drug, so it is a psychotic drug. No, it can cause hallucinations, and it can also cause personal injury to the animal as well as to the attendant that is handling the animal. Um, it is again a psychedelic drug, so it can cause personality change to the animal and nystagmus or the repetitive uncontrolled movement of the eyes. Risk effects on the cardiovascular system. So again, the dissociative anesthetics can cause cardiac arrhythmias in response to, of course, sympathetic nervous system stimulation, particularly the epinephrine release. So it is important to screen the patients for pre-existing heart disease, and of course, when there is the presence of the heart disease, so this drug may be contraindicated. Higher doses, dissociative anesthetics can cause respiratory depression, respiratory arrest, and it can also significantly increase the salivation and respiratory tract secretions. It can also cause pain after IM injection due to tissue irritation. It can also induce an increase in the intracranial and the intraocular pressure. So dissociative agents now should be avoided in patients with history of head trauma now because of this effect, the increase in the intracranial pressure. The uses of the dissociative anesthetics, so they are useful usually in cats and horses. They can be used in combinations with tranquilizers. They can be used for short procedures, anesthetic induction for intubation, no, for anesthetic gas, chemical restraint in cats, immobilization for large and exotic animals, as well as pain control. So this agent has no effective reversal agent. Of the properties of ketamine. So ketamine is approved for use in cats and subhuman primates. It is also used in dogs, birds, horses, and exotic species. It is considered to be a controlled substance because it has the potential for abuse. It has a rapid onset of action due to its high lipid solubility, and for cats, it can be administered IV or IM or orally. Injections of the drug should be avoided, and recovery from the dissociative anesthesia or ketamine can occur 2 to 6 hours. For the elimination, so in dogs, usually it is via hepatic metabolism, and for cat, that is through the renal metabolism. And again, it is often used in combination with tranquilizers because it can induce the cataleptoid state. IV induction can be used also for dogs and cats. For drug combination, so again, it should be combined with the benzodiazepine, um, such as diazepam, so it can be combined in equal volume, and they can be mixed in one syringe. And of course, you have to watch out for precipitate. For the onset of action, it occurs about 30 to 90 seconds after administration IV. For the duration, it is faster, 5 to 10 minutes. And for the recovery, it is only about 30 to 60 minutes. Alternative combination for IM injection are, aside from the diazepam, we also have the midazolam. Tiletamine. Again, tiletamine is usually combined or sold only in combination with the benzodiazepine sulazepam, which is a tranquilizer muscle relaxant. And this is available as telazol. So telazol is sold as a powder to reconstitute with a diluent. And this is stable for 4 days at room temperature, 14 days if refrigerated. This is a class 3 controlled drug, and it can be used in combination with other tranquilizers or with ketamine. Possible long and difficult recoveries is characterized by this tiletamine sulazepam, and this is metabolized in the liver and excreted via the kidney. The advantages of telazol as compared to that of ketamine. So again, telazol is a combination of tiletamine sulazepam. There is a decrease in the apneosic respiratory response with telazol. It can be administered SC, and it is used effectively also with some wildlife. From telazol, we also have zolidil. So this is also the combination of the tiletamine and sulazepam. Drug combinations, ketamine, midazolam, or ketamine diazepam can be administered after premedication with ace-promacine, opioid, to provide immobilization for diagnostic and minor and invasive, non-invasive procedures. In the case of the non-invasive procedure, in the case of the invasive procedures, better pain control is achieved when ketamine is combined with alpha-2 agonists. So when we say alpha-2 agonists, this refers to our xylazine, medetomidine, dexmedetomidine. Plus, we can also add an opioid analgesic. In the case of the aggressive animals, all the drugs can be mixed in the same syringe and administered as a single injection. For example, we have, a combination of ace-promacine, morphine, midazolam, ketamine, or medetomidine, morphine, ketamine. The same approach can also be used for tiletamine sulazepam. Of tiletamine sulazepam, it has also been used combined with ketamine and xylazine. So xylazine is, of course, your alpha-2 agonist, and it can be used as an anesthesia cocktail named TKX for feral cats. These are our dissociative anesthetics. So these are the phencyclidine, ketamine, and tiletamine. So let's now proceed to etomidate. So etomidate is an uncontrolled sedative hypnotic imidazole drug. The main indication of etomidate is that it is used for induction of anesthesia in patients with moderate to severe heart disease. So in small animals, particularly in dogs and cats, it is usually used for cardiac dogs. For dogs, they usually receive an opioid agent known as pre-anesthetic agent, particularly methadone and morphine as a pre-med. So etomidate can also be mixed with fentanyl and administered IV over 2 to 3 minutes to effect. So this drug has a minimal effects on the cardiovascular system. It is quite expensive. It can induce pain with IV injection, and nausea and vomiting is also possible. for the MOA of the Etomidate, so it has a similar MOA to that of barbiturates and propofol. It will increase the GABA inhibitory action. So it mimics the action of the GABA neurotransmitter. It has a short duration of action because it also, just like the barbiturates, it also undergoes a rapid redistribution away from the brain and rapid metabolism, and it has a wide margin of safety. Effects on the CNS, so it can induce hypnosis. It has a very little analgesia, decreased brain oxygen consumption, brain perfusion is maintained, and it also is an anticonvulsant. Yes, so it can cause initial hypotension, and there is also a minimal effect on the certain heart parameters such as the heart rate, rhythm, BP, and the cardiac output. For the respiratory system, it can cause an initial apnea, and it is able to cross the placental barrier. For the musculoskeletal system, so it can induce muscle relaxation and spontaneous muscle twitching and movement. These are the adverse effects of etomidate. So it can cause painful IV injection. Another is that it can induce peripheral sterile abscesses when, of course, it will be administered IV. No, and it can also cause hemolysis with rapid administration, particularly in cats. A characteristic of the etomidate is that it will decrease the adrenal cortex function so that the cortisol levels will also decrease. It can also induce nausea, vomiting, involuntary excitement during induction and recovery. Consideration when using etomidate is that we have to premedicate with opioid since it does not produce analgesia, significant analgesia, and we can also do diazepam for tranquilization. We have also to medicate a dexamethasone. So dexamethasone is a corticosteroid. Since of course the one of the adverse effects of etomidate is that it can cause the suppression of the function of the adrenal cortex by suppressing the production of the adrenal steroids. Repeated boluses is also important to maintain anesthesia. We have guaifenesin. So guaifenesin is classified as a non-controlled muscle relaxant. It is commonly used in large animals for muscle relaxation to facilitate intubation with anesthetic gas, is induction and recovery of the animal. This is not an anesthetic or an analgesic, and its mode of action is not fully understood. Guaifenesin induces skeletal muscle relaxation, and it has a minimal effect on the cardiovascular and the respiratory systems. It's overdose, so it can cause muscle rigidity and apneustic respiration. There can also be perivascular tissue irritation and hemolysis, particularly in ruminants and horses. Considerations in using injectable anesthetics in dogs and cats. So currently we have propofol, alfaxolone, etomidate, ketamine, and tiletamine are considered to be the most frequently used injectable in these species, in dogs and cats. So these drugs are usually administered after premedication with sedative and analgesic drugs to induce unconsciousness, immobility for diagnostic or surgery procedures. So it is important to have a good understanding of the pharmacological properties of the anesthetics so that it will allow the anesthetist to provide safe and effective anesthesia according to the needs of each patient.